afternoon. You are here with Sharon Reed again, the Heart Lady Talks, and thank you for joining us. We are continuing our series about alternative medicine and alternative healing. And of course, you know that I love chiropractors, and I'm bringing you another chiropractor with a different perspective or another perspective. It's all about the same.
It's all about the same.
People healing and feeling well. And of course, I always ask my guests to debunk the myth. So a lot of people, I talked about in my last series how people usually think that they should come to a chiropractor if they were in a car accident because that's where they send it. Mm-hmm. But then a lot of people come because they have lower back pain, right? So what else, Chelsea? Do you hear that people, what is the myth around it, and then correct the myth for us?
Absolutely. So neck pain and headaches are another really common one that people think of. Oh, my neck hurts, I should go to the chiropractor, get one adjustment, and I'll be great. And the unfortunate thing is that our bodies weren't designed for the life that we're living in 2020. Now that goes into low back pain, it goes into all areas of health. But if you think about the way the human body is designed, we're designed for movement. So when we end up sitting all day long, especially sitting at a laptop now that everybody is working from home, or even just in an office setup that's not tailored to that specific person, you are set up for failure from the beginning of the day, even if you do everything else that's right. So posture plays a big role, as well as our personal stress. And now, so I tell people that, and they say, well, you know, but I'm not stressed. I don't feel stressed.
Yeah.
But your stress can be physical, chemical, or emotional. It's everything from what we eat to what's in our water to any vaccinations we've had or fillings, how we sit, the way we carry ourselves, if women carry a large purse, things like that. In addition to the emotional stressors that we personally experience and that our culture experiences. You know, I think 2020 has really taught people more who weren't aware before about the power of the collective anxiety.
Oh, absolutely.
You know, even if you're not personally experiencing something, everybody feels it around the holidays anyway.
And it's going to be exacerbated even now.
Yeah, exactly.
During this crisis, yeah.
So, the first part of that, of course, being one adjustment's usually not going to fix you because it took a long time to get where you're at now. The other thing is, of course, when we put things back into place, the body's going to work better. Your body's designed to heal itself 24/7, 365, but those stressors interfere with our ability to heal.
So there's a couple of things that I wanted to touch on. So you use the term adjustment.
Yes.
And so how does having a chiropractic adjustment help to heal the body, help to correct it? Tell us a little bit about how that works.
Yeah, absolutely. I love that question. So our brain and our body always are trying to take care of ourselves. There's something called homeostasis, which is essentially your body's ability to adapt to your environment and get back to where it should be, its optimal state. But those stressors interfere with that. They cause resistance and interference. And so what happens is we don't heal the way that they're supposed to. We remove or reduce that communication between the brain and the body.
Okay.
It's kind of like if you're reading a recipe over the phone to your girlfriend and she says, okay, well, it's half a cup of sugar, and you hear 1 cup of salt. The recipe will come out very differently.
Very different.
Than if you had heard her correctly.
Right.
And the same thing happens in our body. If we're getting a signal from the brain down to the body or from the body back up to the brain that's not correct, we're not able to heal the way that we're supposed to. So what adjustments do, chiropractic adjustments, reduce the interference that shows up in our spine and in our nervous system so that that communication can be restored. It's kind of like a cell phone cord. Everybody has that charger for your phone, and we've all broken one, right? Either we've bent the plug or we've bent the cord itself one way or another, having it in our bags, right? And so what happens
wear and tear
is wear and tear, exactly. And that simulates interference in the nervous system. Its communication can't happen the way it should.
So the adjustments make correct the communication via the body to the brain.
Exactly.
And so how often should we have these adjustments? But before I go to that, so when you say adjustments, I wanted to kind of paint a picture, a visualization, what adjustments mean, because some people, like myself, years ago, when I first came, I was like, I don't want anybody cracking my neck and cracking my back and put their knee in my. I just felt that was too much trauma. Even today, to tell you the truth, this is the reason why I see Dr. Chelsea and Dr. Hurd at Atlanta Natural Healthcare, because they don't do that unless I guess it varies for different. But for me, they already know. I don't like that that shock, but so much. So tell me, give them a visual again of what the adjustments would look like if they came to your office.
So I can speak from my experience and about chiropractic as a whole. So here's the beautiful thing. I think a lot of people think that all chiropractors are the same.
Yes.
Just like they might think that all general practitioners are the same, all dentists are the same, but we actually know there's a lot of difference as a person, as a professional, and just what works for our patients and what doesn't.
Right.
So there actually are over 300 different chiropractic techniques.
Oh, really? Okay, 300.
Yep, and some of them use hands, like traditionally thought, and some of them use adjusting instruments, like a handheld instrument, and some of them even use computers, and some of them involve very little touch at all, kind of like more of a almost chiropractic equivalent to Reiki or energy healing.
Oh, is that right?
Yes.
Oh.
And just different formats based on what the person's nervous system can handle. So I've had children with autism and ADHD who can't handle a lot of outside stimulus.
That's right.
We're working sometimes even above the skin. And if you're not familiar with energy work, that might sound a little hokey.
They're getting used to knowing what that is. That's why I do these series.
Yes.
So it's almost like a healing touch then you would do.
Sort of. A friend of mine effectively refers to it as surgical Reiki. And I don't practice medicine, so it's not surgery, but it's a similar way of thinking where it's a little more laser targeted than an energy healing would be, in that rather than allowing the body to self-acclimate, which energy healing, in my experience, and I'm not an expert, more generally does, it allows for a little bit more precision focus at that particular spot. And neither is better, they're just different based on the person's individual needs.
That's right, their constitution.
So, and to circle back, some adjustments happen by hand. Dr. Hurd and I both do plenty of what people call manual or hand adjustments, sometimes also called diversified, based on what the patient's needs are. But even within that, there's still a wide range of practice, because it could be someone who's trying to move lots of segment at once, what's called global manipulation or global adjusting, or and that's more so done by like osteopaths and PTs. Whereas most chiropractors who are doing hand adjustments are working on just the segments that need to move. So it's much more gentle, and it's also less stimulus for the body. And it's all based on what that individual needs. And again, the practitioner. So if you've had a hand adjustment and it wasn't the right thing for you, it doesn't mean that chiropractic care doesn't work. It doesn't mean that chiropractic care isn't for you. It just might mean you were with the wrong practitioner, and I strongly encourage you to get a second opinion, because
referrals work. Yes, having that personal relationship. And I think that's a key point. You may have had not such a great experience with one, doesn't mean that you need to label all of them that way. You just need to go with that you resonate with, one that fits you, get it from another referral source that you really trust and can tell you about the experience they've had. Dr. Chelsea knows I have referred a whole bunch of people.
And I appreciate that.
So usually when they come, getting the adjustment, you keep on your clothes, you lay on something that's like an exam table, and sometimes they use a percussor, sometimes they'll use the hand adjustments. We'll talk a little bit about kinesiology, because that's also integrated. But also in your practice, you do a nutritional analysis type.
So to some degree, that's more my office mate. That's Dr. Hurd's specialty. That's